Right now, it's important for us to look at flu issues. I mean, we're seeing a huge bump in the number of people who are being seen in the clinics for flu. We've seen a bump in the hospitalizations. We're almost near 300. We've seen increased absenteeism with kids back in school as a result of probably respiratory illnesses, maybe flu. So I think it's important for us as a community to be aware of what to do when you are A, concerned about flu, and or B, looking to actually treat flu. The good thing is that our message is consistently the same. We will always encourage vaccinations. I know there's been some concerns about the benefits of this year's vaccine. What we are seeing, at least locally, is that the strains of influenza that are being identified are those in the vaccine. So that's encouraging. Okay. We also know, however, that not only have we seen close to 300 hospitalizations, we have seen some deaths. And those individuals who have succumbed to the flu, A, they have underlying medical issues, and unfortunately, they haven't been vaccinated. So for us, that's encouraging from the standpoint of the vaccine does seem to be effective. That's good. But nonetheless, people will get flu. They may get vaccinated, they still may get the flu. And so what do you do? Okay, so we will always encourage traditional supportive measures with respect to when you get the flu. Okay, what does that mean? Okay, you take care of yourself. Drink plenty of fluids, get rest. You're going to feel a lot of aches and pains. Take Tylenol, take ibuprofen, rest. Okay, people will oftentimes have fevers, and that's what really makes them feel badly. So again, Tylenol, Advil, cool baths. You're going to have chills. Okay, take care of yourself. That's if you are starting to come down with symptoms, okay? And again, acknowledging that not many times can we as physicians really take care of flu. So a lot of it's supportive measures, but there are times when I'm going to recommend that you go to see your doctor. First of all, call. If you have any questions, call your office. Call the provider office and ask. But if you have underlying medical conditions, if you're over the age of 65, or you have very young children who you believe have the flu, those are groups that really would be benefited by being seen earlier, because those are times when, again, there are some antiviral medications that can be used, especially within the first 48 hours of onset of symptoms. That's treatment, okay? That's when you get the flu. But importantly, we talked a little bit about preventing the flu. Let's talk more about preventing the flu. Okay, vaccines first, okay? Simple preventive measures include what we call respiratory etiquette. Okay, if you're around somebody and you're coughing or you see them coughing, okay, you cough into your sleeve, not into your hand. Acknowledging that's a respiratory illness that's caused by respiratory secretions. Okay, recognize that people are going to be coughing into their hand and then holding on to a doorknob or putting something down on the table, or they're giving you money if you're a cashier. Wash your hands regularly. Okay, soap and water is good for 30 seconds, but also the hand washes, the sanitary, hand gels, great, okay. Other simple preventive measures, if you're not feeling well, don't go out. Don't go outside and potentially infect somebody else. Stay at home, okay? Because again, your illness can be easily transmitted to someone else, and that's why I'm not encouraging you to go to the clinic. Because again, you walk into a clinic, into a waiting room, and you're ill, you are going to potentially make others ill. So again, stay home if you're ill. Stay away from individuals who, again, may be ill. If they tell you they're feeling lousy, take their word for it. Don't go visit them yet, okay? But again, a lot of prevention measures are really beneficial because flu is a very communicable disease. But again, with simple, basic prevention measures, you can prevent yourself and others from getting the flu. If you get symptoms, think about, again, the severity of symptoms. If you have significant problems breathing, underlying medical conditions, call your provider or seek emergency care.